The art of medicine. So the patient, here he is, lying in bed, he's reading a book. Nowadays he'd probably have his tablet computer with him, or his Google glasses if he's up to date. So here's the patient lying in bed, and he's called for the doctor. Here the doctor is, he's arrived. The doctor feels his pulse. That's to check on his heartbeat. And he looks upon his urine. So in the olden days, doctors would ask patients to urinate into a glass jar, and they would inspect the color of the urine to see if the patient were ill or not. We don't do that much nowadays. And then he gives his prescription, which he's writing out here, and he writes it out. He writes his prescription out. And the prescription then is sent to the pharmacist, who you can see here, also called an apothecary, in a pharmacy or a chemist's shop. So he's called a pharmacist or a chemist. And in the pharmacy, the different drugs are kept in drawers or in boxes, which you can see around here, or in flasks, which you can see around, stacked up. The boxes, the flasks. And it's either a potion, which you can see here, a liquid, or it's in powder form. The drug can be powder, which you then mix with water or wine, or little pills, which you can see here on this plate, little tiny dots, and those are the pills, or pastilles, which are like soft, chewy things like wine gums, which will have the medicine in them, or an electuary. Now, an electuary, we actually use this quite a lot nowadays. If you go to the pharmacy and you buy a cough mixture, liquid cough mixture, so that's an electuary. It's the drug mixed with sugar, sometimes alcohol, sometimes honey, to make it tasty, and you drink it down. So that's an electuary. Diet is the best medicine. The surgeon, that's somebody who cuts you open. He cures wounds, so he either sews the wounds up or he cuts them open and then restitches them, sets bones, etc. And he also fixes ulcers, and he puts plasters on them. Also in the chemist shop here you can see a pestle and mortar. This is a great big stone or metal container, and the pestle inside is used to grind medicines up into powder to make the drugs. Because nowadays pharmacists don't tend to do this, but even as recently as 30 or 40 years ago, pharmacists would prepare their own medicines in their pharmacies, and some still do prepare some of the medicines themselves from scratch, but this is much more rare. And of course in the future we're going to have printers that will print our medicines out for us at home, and we won't need to go to the pharmacy anymore. But we'll have to wait a few years for that.